guys. So today I will show you the navigation of the surgery coding, that is in procedure is incision and drainage of abdominal abscess and excisional debridement of non-viable and viable skin, that is subcutaneous tissue, mergel, and then the removal of foreign body. Okay, so we have to first read all the documentation what the provider has given, what the technique is used here. So first, that is pre-operative diagnosis and post-operative diagnosis, which is same, but always take post-operative diagnosis. If some extra is there, we should code that. But so here is an abdominal abscess wall. Okay, abdominal wall abscess procedure. We have read that, and indication is patient is 60-year-old gentleman, sigmoid colostomy for, sorry for the disturbance, guys. First finding is the patient was found with an abscess went to the level of fascia and the anterior layer of fascia and some portion necrotic and there is seasonally debrided using movie cautery and multiple pieces of suture within the wound, and these were removed as well. Okay, technique what is used? Patient has identified, taken to operative room and where the induction prepped and wrapped in sterile fashion and the wound open. Okay, so wound has been opened and draining was using and curate. Okay, the extent of the wound marked, making pen, and abscess was opened and drained. So incision and drainage is done. Okay, I noted there was a significant amount of undermining in the on the same incision site. He found an undermining, and these margins were marked and excised with movie cautery, and the curate was used to remove the necrotic fascia. So we have seen that the documentation say the incision and drainage, while incision and drainage, the provider would see the undermining and he moved the necrotic fascia. So it's included, and wound was packed after that, and the recovering in the stable condition. So how to navigate? First of all, we have to navigate for the diagnosis: abdominal abscess, wall. Okay, so it already coded. So I will show you the navigation. Okay, abscess. We have to spell abdomen, abdominal wall, and its wall. Nothing is there. Will move. Okay, so this one came. Coming to next, we have to procedure about the incision and drainage. So IND, incision and drainage of the abscess, abscess wall. Okay, with the drainage, abscess. Complicated because packing material has been used. Okay, so this one is. And again, we will code for the debridement. Debridement, I will show you the navigation. Debridement has been done. Na? Debridement. Skin and subcutaneous. Muscle and fascia, you can see here, muscle and fascia is used here, muscle, necrotic fascia is used here. Okay, so we'll coming to this. So it's in one and it's 11043. Okay, we'll remove one by one. Okay, so here according to the NCCI edit, what is showing that code 2, this is a comprehensive procedure, but we'll delete this code. Why? Because we have to code according to the documentation. What documentation given? Only incision and drainage, and while incision and drainage, he's found some undermining, so it included. So regardless of the NCCI edit, we have to delete this code and code only the incision and drainage, because incision and drainage, the debridement is in part of incision and drainage. Okay, some collecting the fluid. Okay, so this is an overall of the navigation of the abdominal abscess wall and incision and drainage. So that's all.